Hello, if you're watching this slide, it's your first time having cataract surgery with Dr. Winston. Dr. Winston has performed cataract surgery since 1985. Your surgery will last approximately 3 hours from the time you arrive until the time that you leave. You'll be arriving approximately 1.5 hours prior to the surgery at your designated time. Surgery is approximately 20 minutes long, and you'll be in recovery area for about 40 minutes. You will need a ride home, and you can drive the next day if your vision is adequate. Your first post-op visit is the same afternoon between 2 and 4 p.m. If you cannot get a ride that same afternoon, you can make an appointment for the next day and drive yourself. You will not need to make an appointment. At the surgery center, Dr. Winston will let you know what time to come in that day. You should have a sheet that looks like this. It's called the list of the surgery centers. At the top it states which eye you're having cataract surgery on, right around here, the date of your surgery, your location, and your arrival time. Your location will be one of these down here, and they will be circled for you. If you are having surgery at the St. Jude Medical Plaza, the plaza is on the west side of the street of Harbor, as the hospital is on the east side. We are located right behind the surgery center over here, just so you kind of familiarize yourself with where the surgery center is at. If you pull in through a small road that's right between our building and the Bank of America, they will valet your car for free. If you park in the self-parking building, it is not free, so please make sure that you do valet your vehicle that day. For those of you going to the Center of Outpatient Surgery, it is on Whittier and Colima in the same corner as the Marie Callender's. There's a small road called Janine Street that is right behind the surgery center. That's the easiest place to enter for self-parking, which is validated. For North Anaheim Surgery Center, it's located on Euclid, right across from the Norms, if you're familiar with that, and parking is free. If you have already received your eye drops, you will be receiving a sheet that has calendar days marked on there that will match the names on there. So you can feel free to look at your eye drops right now and see if any of this matches what you have. Regardless if you have brand name or generic, you will be receiving 3 eye drops. So first I'll go through the brand name. For example, if you have received Besevence, Prolensa, and Durezol, you will begin Besevence and Prolensa 2 days prior to surgery. Under each eye drop has its specific instructions. So this one says start drops 2 days prior. Prolensa also starts 2 days prior. And Durezol begins when you get home from surgery. That's why day 1 and day 2 here are blocked out. Now, for example, day 1 is 2 days prior to surgery, because that's when you begin. Now day 1 has 2 boxes in there. That means you put 1 drop 2 times a day, only in the surgical eye. Prolensa has 1 box, meaning you use 1 drop once a day. And Durezol, once you begin, is 1 drop twice a day. Besevence will continue 2 times a day for 8 days. When there are no more days here with small boxes in it, that means that you discontinue the eye drop. Prolensa goes on for 31 days. Durezol goes through until day 16. If you run out of any eye drops, there is refills that are available at your pharmacy. Now this is a sheet that has an example of generic eye drops. There will also be 3 different eye drops. The first 2 also start 2 days prior. The third also starts when you come home from surgery. The only difference is that these have more drops per day. So for example, ofloxacin is 4 times a day. Ketorolac, or Acular here, is 4 times a day. Prednisolone is 3 times a day. Just make sure that whichever eye drops you receive, you follow the instructions accordingly. Bring your eye drops with you if you've already received them to your pre-op appointment, and we will give you a sheet that matches what you have. Pre-op instructions, most important, do not eat or drink anything the morning of your surgery. We will send an electronic prescription for your eye drops to the pharmacy for you. So just like the drops that we just covered, bring those with you to your pre-op. You will have the prescriptions filled as soon as possible as they begin 2 days prior to surgery. You need a physical examination by your primary care doctor that should be performed within 30 days of your surgery, so no earlier than 30 days. If it's what the hospital considers too old, they will not accept it for your surgery day. Let's see, 2 days prior to your surgery, you'll start both your eye drops 5 minutes apart. You'll also need to clean your eyelids and your eyelashes with the OcuSoft lid scrubs that we will provide a sample amount in your pre-op kit. You'll receive that on your pre-op appointment. Now, your surgery will be performed while awake with the local anesthetic and a mild sedation given by an anesthesiologist. This is commonly called a twilight sedation. Most patients do not remember anything about their surgery. They have the IV put in and they wake up in recovery. And the few that do remember anything just slightly remember Dr. Winston speaking to them, but it's more like a dream. You're not as alert as you would imagine for technically being awake. Now, medication instructions are to not take aspirin, Motrin, or Aleve 7 days prior to the surgery to reduce bleeding. If you're taking high blood pressure medication, that's the only one that the doctor likes you to take the morning of surgery with just a small sip of water. Do not take your diabetic medications on the morning of surgery, except if you take a long-acting insulin. You should take half of that morning dose. Now make sure you bring a list of current medications with you to your next appointment. That way that Dr. Winston can review it with you and he'll let you know which ones you can or shouldn't take the morning of surgery. If there are any blood thinners that were listed there that are prescribed by, let's say, a heart doctor or something that you are worried about discontinuing, always make sure that you check with the doctor that prescribed it to you as well. After your surgery, you are to resume all of your oral medications like normal and any of your other eye drops that you normally take. Please do not discontinue them while you're taking your new cataract surgery eye drops. Everything should go back to normal. You'll be keeping your eye covered and protected at all times, so 24 hours a day, by either wearing your glasses or your eye shield for that first week until you see the doctor again at your first post-op. Now, this means your shield while you're asleep, eyeglasses if the prescription does not bother you, or your sunglasses that you will also be receiving in your post-op kit. The eye shield should be worn at bedtime or any naps for that first week until you see the doctor as well. No lifting anything over 15 pounds or bending down to the ground any strenuous activity for 2 weeks. You can go for regular walks, just make sure no running, no jumping. Any exercise classes that you take should be what you'd consider just quite mellow, like easy level. Nothing too strenuous. You can take Tylenol every 4 to 6 hours for any discomfort after surgery, though it's not usually needed, but Tylenol is a safe way to go. Now, if you have any pain that's not relieved by Tylenol, please make sure that you call our office so that you can be seen by Dr. Winston, and most importantly, do not rub your eye. Remember to wear your sunglasses when you're outside. Keep dirty water out of the eye for 5 days. And dirty water just means like when you shower, shampoo your hair, don't let it run down your face where it would go into your eyes. You can also wear your shield when you're in the shower to help keep anything out of your eyes. And again, you may drive the next day if your vision is adequate. You're the best judge of how well your vision is that next day. New eyeglasses will usually be prescribed about 3 weeks after surgery, And in the meanwhile, if your old glasses don't seem to be working for you anymore, which they may not, a plus 2.25 over-the-counter reading glass can be used to read. It won't hurt your eyes, it just may not be the exact prescription for you, but it will not hurt you. Now make sure that you call our office if your vision worsens, or if you have an increase in eye pain, or an increase in redness. It's normal to have blurred vision or for everything to seem very bright the first day of surgery because your eye will be very dilated and possibly even throughout the evening. But if the days go by and your vision seems to worsen, that is not normal. Eye infections are very, very uncommon, but they usually occur 2 to 5 days after surgery, and only prompt recognition can save your vision. We look forward to seeing you after your first post-op, same day, afternoon, with Dr. Winston. Thank you, and have a good day.